Hi, I'm Abby. I'm an occupational therapy student in my last semester of school, and I'm creating these little mini lectures as part of my final project. Today's topic is going to be what occupational therapy looks like in a school-based setting. So the first question that I would like to answer is, what is occupational therapy? Generally speaking, occupational therapists help people participate in those activities or tasks that are important to them, that they need and want to be able to do every day. So, in hospitals or clinics, therapists address those activities that we call activities of daily living. And those include eating, bathing, dressing, toileting, mobility, and transfers. So, working in the general population, that may look like helping a child who has a motor delay learn how to coordinate their movements in order to brush their teeth, or helping an older adult relearn visual skills they need to get back to driving after having a stroke. So, next, I would like to answer the question, how is occupational therapy in a school-based setting different than occupational therapy in a pediatric clinic setting? In a pediatric clinic setting, OTs help children with things like fine motor control, coordination, movement planning, sensory processing, mental flexibility, along with many other skills as they relate to daily tasks, such as brushing teeth, brushing hair, getting dressed, playing, or participating in a family meal. In the clinic, an OT can focus on challenges in any aspect of the child's life. However, when it comes to schools, according to the Individuals with Disabilities Education Act, or IDEA, occupational therapy means services provided by a qualified occupational therapist and includes improving, developing, or restoring functions impaired or lost through illness, injury, or deprivation, improving ability to perform tasks for independent functioning if functions are impaired or lost, and preventing, through early intervention, initial or further impairment or loss of function. However, the child's deficit must be impacting the child in the classroom. As compared to the clinics, in the school-based setting, occupational therapy has a much more narrow focus and is limited to addressing abilities or behaviors that directly impact the child's academic participation and performance. Our focus is primarily on helping children with their academics through the areas of fine motor skills used in the classroom, play and social interactions, strategies for behavior management, strategies for kiddos with learning disabilities, strategies for transitioning, and help with classroom modifications. I would like to emphasize if a child is experiencing a challenge in an area, and even if that area is within our scope of practice as occupational therapists, if it's not directly impacting their academic participation or performance, then unfortunately it's not appropriate for us to address it in a school-based occupational therapy session. So, what skills can we work on? We can address activities of daily living that I mentioned earlier, attention, assistive technology, environmental modifications, executive functioning, fine motor skills, gross motor skills, leisure skills, play, rest and sleep, seating and positioning, sensory processing, social skills, visual motor skills, and vocational skills. But I really want to emphasize that we work on any of those areas as long as they're impacting the child in the classroom. An area of emerging practice for occupational therapists is helping teens in their later high school years develop plans for transitioning out of high school. We help them figure out what goals they want to set and achieve after school and help them figure out the steps they need to take to achieve their goals. The next topic I would like to talk about, and that I think is important to mention, is that occupational therapists do so much more than just handwriting. And when we address handwriting, we are working on the foundational skills of fine motor control and a functional grasp. So, if a child has those basic foundational fine motor skills that they need, and they have a functional grasp on their utensil, they may just need more exposure or practice with handwriting. It doesn't necessarily mean that they need to see an occupational therapist. Before wrapping things up, I want to talk about collaboration. The best outcomes for a child occur when the teacher and OT collaborate to find the best way to help the child who is receiving occupational therapy services. Discuss strategies that can be taught in an occupational therapy session and implemented in the classroom. Talk about things that you see are going well and other areas that still need work. And if an OT gives you a classroom modification or behavior management strategy, give it a try. It may be exactly what that child needs to be successful in the classroom. And if what the OT suggests isn't working, then that should also be communicated. And you can problem solve together to promote the success of that child in the classroom. So, to summarize, OTs have a wide variety of skills that we can address in our therapy sessions that fall within our scope of practice, but not all of those skills are appropriate to address in a school-based occupational therapy session. School-based OTs address a deficit a child is experiencing when it directly impacts their academic participation and performance. Reach out to your school-based occupational therapist for any help you may need with a kiddo in your classroom, or collaborate with your OT for students who are already receiving occupational therapy services. Thank you. I hope this was helpful.